So historically, it's like women of color are not allowed to feel pain. And if they feel pain, they need to know that they should put up with it. So even a sick sheet at work might not really suffice. Yes. My name is Mwari Muthaura. I'm a clinical psychotherapist in private practice, and I work with individuals and families through healing. So for grief, trauma recovery, personal reinvention, chronic illness, day-to-day adjustments. And my approach blends evidence-based therapy with creativity, art play, somatic work, just helping people reconnect with themselves, not just through words, but through their body and breathing. Incidentally, as we talk about chronic illness, I also live with lupus and endometriosis, as well as ulcerative colitis. So I like that we're having this conversation because those experiences have deeply shaped how I live, how I love, how I rest, how I work, and how I serve people. In chronic illness, grief is not even an event. Right? It's a process, it's a rhythm, it's a quiet reweaving of who you are. It's a readjustment, which you have to do with tenderness over time, because you're also learning yourself and things your body is capable of doing that you didn't know.
As much as we trivialize people's experiences, trying to understand that even the person having to live with this diagnosis is also trying to figure it out. They're trying to understand what's going on with their body. And the importance of at least approaching them with grace, extend a bit of kindness.
For African women, Black women, women of color generally, African women, we face, especially women, we face additional layers of medical bias. So if it's bad for a man, chances are it's more magnified for women. And there's a damaging myth that we are built to endure more, that we are just naturally strong.
Hi everyone, and welcome back to yet another episode of Circling the Rabbit Hole podcast with me, Dr. Claire Kinuthia. Before I start, I want to give a big shout out and a huge thanks to our location partner, that's Ashley Furniture Home Store and Fair Deal Furniture, for being our new home in season 4 for Circling the Rabbit Hole. We're very excited. So today's episode, I have a repeat guest, a dear friend, and who I'm going to assign the title CTRH Pod Psychologist, Resident Psychologist. And we're having yet another, I feel, going to be very impactful conversation around our mental health when related to reproductive health issues. And before we get into the episode and I ask her to introduce herself, I'll take us through a few statistics. So the topic of today is navigating chronic illness, and this is the psychological aspect. And I'm hoping that we can gain a few tools for, especially so women, because we're going to talk about how health has a huge impact on women's productivity, how we engage with people in society, and just basically the quality of life that we have. So it's well known that women live longer lives on average. But however, the thing that's not as well known or recognized is that they spend 25% more years in poor health. And according to Forbes, the statistics read that the global women's health gap ranges between 15 to 40% globally. And what that means is, yes, we're living longer, but then for a large amount of time, and they put it down to an average of 9 years, women are living in poor health. And a lot of this is during their most productive time, which is age 15 to 55. So the time where you're supposed to be the most productive at work, you're supposed to be achieving your goals, you're actually climbing up the ranks in corporate or whatever it is that you do, is where you're suffering the most while navigating health issues. Then we look at the specific health burden. A large proportion of this is from conditions that affect women exclusively, and this is maternal or gynecological issues. There's also a big proportion that's of conditions that are common between men and women, but tend to affect women more disproportionately. So if we're looking at issues like autoimmune diseases, mental health challenges, headache disorders, chronic pain or chronic fatigue disorders. And then we have another aspect of diseases that affect both men and women, but affect women differently. And that is things such as heart conditions, certain types of cancers like colon cancers. Yes, they're both in men and women, but you'll find that women will be affected a lot worse. And there's very little research that was ever carried out a lot of times on medical issues when it comes to women and how they affect women's bodies. So with that in mind, I felt like it was necessary for us to have this conversation because there are a lot of women living with chronic illness of all sorts of forms. And like I've mentioned, just to go over some of them again, autoimmune diseases, chronic pain, chronic fatigue disorders, menstrual problems, so like polycystic ovarian syndrome, endometriosis, adenomyosis, PMS and PMDD. And then we also look at transitional challenges, so puberty and the things that come with menstrual, especially so period pain and severe period symptoms, and then the transition that comes as menopause, because some women experience such severe symptoms that it's also a life-changing experience. So it's then important for us to address this and see if we can help the audience figure out how to navigate some of these conditions and how to, first of all, identify how you feel and then figure out what you need to be able to cope. And that's the longest intro I have ever given yet. So now that the formalities are done, I'll have you introduce yourself for those who may have somehow not caught the other. I think we've been here 2 episodes now.
True, yeah.
Previous, yeah. True. So now this would be our 3rd. So like I said, resident psychologist, thank you for being here.
Thank you.
So if you could please introduce yourself, as is the tradition on the podcast, and tell us a little bit about what you do and maybe on socials where we can find you.
Okay. And thank you for having me. It's always a joy to be here. My name is Mwari Muthaura. I'm a clinical psychotherapist in private practice. And I work with individuals and families through healing. So for grief, trauma recovery, personal reinvention, chronic illness, day-to-day adjustments. And my approach blends evidence-based therapy with creativity, art play, somatic work, just helping people reconnect with themselves, not just through words, but, through their body and rhythm.
Right.
I'm also a jewelry designer.
Yes.
And I create jewelry, and you can find me on social media at Mwari's Gift Cottage. And also my therapy page is Therapy with Mwari.
Yeah.
And beyond my work, I am a gardener, as we both know.
You're a plant mom. That's what you should say, because I've never seen that many plants in a home.
Yes, and I have transformed my house into a jungle sanctuary, but because I love serenity and nature, I find that it's very healing. After a long day of so much emotional work, I like to come back to nature.
Yeah.
But I also live with 5 sweet, chaotic pets. All puppies, Whitey, Woofy, Frenzy, Angel, and Cupcake.
Yeah.
They are chaotic, but they are they bring comfort to my daily life.
So also a dog mom then.
I am a dog mom then.
The opposite yet to my cat mom status.
Exactly. I am a sister, I am a friend, and I like to call myself a super auntie to so many kids, which I enjoy. Incidentally, as we talk about chronic illness, I also live with lupus and endometriosis, as well as ulcerative colitis. So I like that we're having this conversation because those experiences have deeply shaped how I live, how I love, how I rest, how I work, and how I serve people. Yes.
Fantastic.
That's all about me.
Fantastic. So again, yet another thing. So as much as this is what people say about friendships, you don't have to have everything in common, but then there are major grounding factors that
intersections.
Exactly. So for us, living with endometriosis and having to deal with the challenges that comes with, I feel like it informs not just your personal life, but also how you look after the people who entrust their care or their health care to you. Because I find it also informs how I handle my patients a lot of the time. And believing when someone comes in and says, I'm in pain, regardless of what anyone else may have said. So this conversation, it's not just for the masses, it touches very close to home for us.
It does. And it has informed our practices. I mean, we do share many facets of our practice. And I feel that has actually informed how we handle our patients.
True. Yes. So to dive in, chronic illness, basically defined as having a illness or a diagnosis for a year or more, is something that we're seeing more and more commonly, partly because we're getting better at making a diagnosis, or diagnostics are improving, so we're able to identify what the cause of symptoms is from an earlier on phase. Now, that being said, it doesn't necessarily mean we are supporting people better when we give you a diagnosis. So from your experience, what's been the most common first reaction or first response when someone receives a diagnosis of a chronic illness or a debilitating illness, sometimes a degenerative illness? What has been your experience so far?
And there's no one size fits all reaction, right, to diagnosis. So for many, it's grief, which is maybe layered, delayed, and ongoing, because chronic illness just interrupts pain not once. It will keep interrupting again and again. You think you've handled it all, and then it strikes in many other ways that you didn't see coming. So the most common thing I see for people who have been pursuing a diagnosis forever, you've been in and out of doctors' offices, and everybody says nothing is wrong with you, or perhaps you're a psychiatrist, or it's all in your head. I see relief, then rage. Okay? So when a diagnosis comes and somebody has put a name to the condition of what you're having, you're like, okay,
I'm not crazy.
So I'm not crazy.
I'm not crazy,
It has a name. All right then. And then they're like, I have been telling them, I have been saying, there's so much rage that comes with it, and it's rage at how long it took to get this diagnosis, rage at how long it took to be believed, right? And then rage at how many times we were dismissed, okay? And then that follows grief. And it's grief over lost time, lost energy, lost relationships while you were in search of answers because of how much it has cheated you out of life, so to speak. And when I talk about grief, it has many facets to it. But before I go there, there's also just shock and numbness. You've seen this, especially with high-functioning people. You tell them something, they just sit there calmly.
Me specifically.
All right? They just sit there calmly. They are listening. They're asking questions. They weren't expecting this news. It may be just an annual checkup or just regular lab work that they've been told, just to do this every few months. Maybe because you're predisposed to something, or maybe because you once had a complaint. And the news, the diagnosis, it lands in silence. So they go cold, they might not ask you questions and keep it together. And then the feelings come later. So it could be in the shower, in the car, at 2 a.m., during a cancelled event, when it hits them, oh, I can't go because of this, right? And it's a protective mechanism, like your body is still catching up to the words you've had, right? So your mind and your body not together at this point. But let's go back to the grief that we talked about. So when people receive this news and they start to live with it, there's a sense of what in psychology we call ambiguous loss, like a tension between hope and grief. So you're here, we are seeing you as Claire, and how we've always known you, but you're not quite the same. And sometimes you're the one experiencing it, or other people experiencing it of you, but mostly you're experiencing it. So you can still do some things you could do before, but not in the same way, or not without consequences. For example, go partying 3 days a week and tell me what your body does to you, depending on where you are at and the cycle.
I'll end up as a patient in hospital.
Exactly. And then we are seeing you in a hospital gown. So ambiguous loss is the grief of uncertainty, right? So you're grieving the life you had before, where you remember who you were, could fit in clothes. For example, me with lupus, I keep 4 dress sizes. I was telling you about this morning.
Yeah.
You have clothes from size 18 to size 14 because at any point, they'll pump you with steroids. And then you don't even know when the weight comes.
Exactly.
So you plan for something, then you have to change it. I mean, that might sound like a shallow example, but that's just like one example of day-to-day living.
I don't even think that it would be shallow because I can remember as women, we tend to be structured and we're planners. So
Organized,
by the time I'm organized and I've planned that the way I'm going to deal with this day or this function I have coming, I've already sorted out my wardrobe. I've already figured out the way I want to look and how I want to represent myself.
Exactly.
Then that morning, this
has
thing
happened
won't
to
even
me
go past my hips.
for a wedding, actually. And noticing on the morning of the wedding that I couldn't wear what I planned, and I was far away from my house, you know?
Yeah.
And then grieving the spontaneity and ease of movement. Like your friends can just call you and say, hey, come to this place.
Yeah.
You have to sort of listen in and see whether you can do it or not. But before, you just pack your bags and go, right?
Yeah.
And then grieving the loss of the body you once trusted. That you would just move around, you'd go for marathons, you would hike, and now you don't know what your body is doing to you or what it might do once you're in public. Right? So it's a kind of grief that keeps returning because your losses keep shifting. So you're caught in between hope that treatment will work and you'll fully function someday and loss that life will never be the same. And it's a very, very severe form of loss because your experiences just keep shifting on a daily. And then there's another kind of loss that we don't talk about, and maybe I'm using big terms, but we can all learn together. It's called disenfranchised grief. Okay? It is grief that society ignores. You're not entitled to it.
Okay.
So I say you're looking like this. I don't know if you're in pain, by the way. But you may say, oh, I cannot do anything today. And then I say, but you don't look sick.
You don't look sick.
You don't look sick.
Sick people don't dress like that or look like this or show up at work.
Yeah. Right? I saw you at the shop. How could you be sick? Why did you skip the party? Right? And we also say things like, at least it's not life-threatening. It could be cancer, you know. At least you're still alive. At least you can still walk. My auntie didn't walk after her diagnosis. So, and other things like you just have to stay positive. So the responses silence the very real emotional and physical losses that you're going through, and you learn to mask your pain and to downplay your struggle. And you smile when you're just breaking down, right? And then another kind of grief would be grief of time lost, correct? So there's grief that comes from very many missed opportunities. So there's years spent undiagnosed. Who tabulates that, right? And then postponed dreams or abandoned dreams. So if you are planning to be super pole dancer,
I mean, my dreams are valid, Ebu.
And then your pelvic area keeps doing things because of the flares, correct? You cannot do it. Or you have something debilitating or degenerating, right? And you cannot hike. You cannot climb Mount Everest if you've been a hiker. I'm using examples of the life, I live the outdoor life.
Exactly.
But friendships are also dissolved during flares. You notice that?
Because again, you can't show up the way people expect you to show up.
Exactly.
Right?
And at some point you start feeling like a burden and you don't want to be around because you're the one who's bumming everybody out. Right? Or you say, oh, I can no longer eat that. And everyone's like, what else is new?
What else is new?
Right? And people can be quite unkind when they don't know the severity of what you're going through. So you look back and you feel like illness has stolen parts of your life that you could never get back. But then another thing would be identity disruption, right? So when you live with chronic illness, you go through some form of an identity crisis, right? So if you've always been the strong one, the doer, the reliable friend, the sister everybody can count on, the independent one, who are you now? What have you become?
Right.
But the other thing we rarely talk about is the emotional oscillation. You're like a pendulum, right? Because grief in chronic illness is not linear, right? In the morning, you're feeling hopeful, you're up, you're looking nice, you're greeting everybody. By noon, you're devastated.
Yeah.
Because now the fatigue has hit you.
Yeah.
And you can barely breathe. And you need to catch a nap or lie down or go to hospital. And then it's a cycle that keeps repeating itself. Hope during remission, grief during flares, acceptance this week, anger the next week. So in chronic illness, grief is not even an event.
Yeah.
Right?
Yeah.
It's a process, it's a rhythm, it's a quiet reweaving of who you are. It's a readjustment, which you have to do with tenderness over time.
Yeah.
Because you're also learning yourself and things your body is capable of doing that you didn't know.
Yeah.
So that's it. Those are some of the common reactions.
Right. Okay.
Yeah.
And that's such a
roller
beautiful...
coaster.
You know, you're also validating me. As I listen to you, I'm like, okay, so I'm not insane. Because you can wake up great, and then I try 60 different outfits, and now I'm like, I'm bummed the rest of this day. Because nothing fits or doesn't fit, or this
water
body
retention.
This body is a foreign concept. I no longer understand what's going on.
Yeah.
And so as much as we trivialize people's experiences, trying to understand that even the person having to live with this diagnosis is also trying to figure it out. They're trying to understand what's going on with their body.
Yeah.
And the importance of at least approaching them with grace, extend a bit of kindness, because it's a bit more complex. The fact that I don't look like my problems, also
Exactly.
we were raised not, me personally, let me speak for myself, I was raised not to look like my problems.
Exactly.
That was like a hammered in response. So I may be sitting, like you said, I could be sitting here in agony, my hot water bottle is supporting me in the back, and I've taken every painkiller known to man,
patch
just to
somewhere.
Somewhere, and just
patch.
to make it to set doesn't mean that I'm okay, right? And so looking
Not
at someone,
necessarily.
especially
women.
especially, and in fact that's where I want us to go, because for women specifically, especially culturally, we are the ones who hold everyone else down. So my community, my family, everybody relies on me. I am the one who shows up, I'm the one who delivers, I'm the one who makes sure you're comfortable. So I must get up in the morning, make breakfast, make sure everyone's lunch is packed, send everyone off to school, go to work, come back, make sure on the phone throughout, this is what lunch is being eaten, this is pick up time, this is what's for dinner. Creature comforts, activities. It's a specific day, it's a weekend, I need my kids to have their activities in order. If it's school activities, if it's social things, we also have social things with our friends, and we have to make sure we show up for those. And I'm constantly showing up for everyone else, right? But then here you are, you tell me, listen, you have XYZ, and it's going to change your life, and it'll stop you from moving the way you move as a person functioning within your community. Navigating that aspect, because for me it's just trying to also, like we said, we're focusing primarily on women just because of all the issues to do with the health gap, but in our cultural setup specifically, where we're talking about African women of color in general, how do you see a diagnosis of chronic illness impacting them?
And there's some historical and systemic and cultural dismissal of pain for African women, Black women, women of color generally, African women. We face, especially women, we face additional layers of medical bias. So if it's bad for a man, chances are it's more magnified for women. And there's a damaging myth that we are built to endure more, that we are just naturally strong.
We need to suffer.
Yes.
We glorify suffering,
we
actually.
do. And you're told it's just stress. It's in your head. Once you have a baby, you'll be fine, right? We say that to women, especially in your specific profession and field, Claire. We all have stories we could tell of visiting this or the other doctor, isn't it? And so many women live through the years of painful periods, reproductive dysfunction, unexplained fatigue, and you're told that it's normal. By the time you're diagnosed, you're already exhausted, you're already grieving, and that delays treatment and deepens shame and teaches women to not trust their bodies. Like the deep distrust you have of your body and your nervous system, it's quite unexplained in a lot of women, such that someone will look sick and they are in pain and you can see, and they'll say, and I'm also guilty of that, I think I'm pretending to be sick. There's a chance I'm pretending to be sick. For younger
they're
girls,
looking for an excuse to get out of work or of school, or because again, that's something we faced a lot with, and it starts all the way from school. Because,
primary school.
Yeah, when you first get your period, if you're the type who has a very painful period, navigating but you're faking so that you get out of math class, or you're trying to,
I remember the swimming one.
Don't even remind me. I actually watched someone's video recently where she was saying that in their high school, to get out of swimming, you had to be on your period. But you also had to prove you on your period.
Like
so
show your pad or something?
A tissue test.
Oh.
It was so invasive. I'm still in shock, but it's a school in Kenya anyway. Yeah, things like that. So now, if that's what we are navigating when it's a physical symptom, so I'm being told to show my period. Now imagine I'm in pain. How do I quantify or qualify my pain for your acceptance?
And you and I have had to deal, especially with younger women who go through, it's not just the physical pain, but they have PMS, PMDD, which is premenstrual dysphoria, and they cannot talk about it as they're going through some form of depression and mental anguish, because already they cannot even talk about their period and the pain they're going through. And it's taking a chunk of their weeks, and they have to put up with either school, work, home parents who won't believe them, and you're told, do you think you're the first woman to have cramps? You know, we just dismiss it as cramps. Or do you think you're the first woman to have PMS? Or we just say, it's just PMS. You know, we just throw around that word, not knowing that for some people, this actually contributes to even psychotic breakdown. Right? And you've seen that, right? So historically, it's like women of color are not allowed to feel pain, and if they feel pain, they need to know that they should put up with it. So even a sick sheet at work might not really suffice. So it is very real. And then we are watching a lot of mental health conditions ailing women just because they've had to put up with pain, and this now starts to contribute to anxiety, depression, autoimmune conditions, and so on and so forth.
Sometimes even just lashing out.
Trauma.
That mean woman in your office, and everybody's terrified
She's
of her.
carrying a lot in that body.
Sometimes turn the lens back inwards, and you realize maybe there's something she's navigating, and it's traumatic for her. But again, because nobody listens, nobody believes you. It's no one else's problem. The world is not kind. I'll take it out on you.
I'm a bit calmer now. My children are liking being around me more now. And I didn't know that this was an illness. Because I was in so much pain and I couldn't tell what was going on with my body. And all this is reproductive health related, isn't it? Yes. So it's a very real thing. We do have a bias against women and how much pain they ought to carry.
Yes. What are some of the negative effects that come up from not processing my diagnosis? Because now we're talking, there's some who lash out, there's some who are nasty and all of that. What happens if I fail to navigate the grieving process properly? And we do talk about the grief cycle. A lot of people talk about it even in forms of memes and reels, and you know, it looks funny, but it's very real, because we do have, initially when it starts, it's denial, right? This can't be happening to me. Excuse me. Then you minimize your symptoms. You delay treatment. You push yourself as if nothing has changed. Because a lot of people will be like, if I start pursuing treatment, who'll take care of my kids? I can trust my husband with this, or my boss will ask me not to come back to work. And denial serves as a protective pause to give your mind time to catch up. Where it's dangerous is if you do not move to the next step, which sometimes it's okay to have the anger. Anger sometimes is the next step, where you're angry at your body, you're angry at the doctors who missed it, or at the doctor who pointed it out. You're angry at friends also,
who are,
we're
mad at them.
We're mad at the one who actually made the diagnosis.
My life was peaceful before you said endometriosis, you know? Which was it really?
Was it really though?
They become the object of wrath. We are mad at friends who've disappeared. Everything feels unjust in that moment, especially if you had been dismissed or misdiagnosed for a long time. And then we have the bargaining, as if you're negotiating with life. if I just eat better and rest more and pray harder and have more faith, maybe it will go away.
Yeah, and recruit my prayer warriors and
I know.
if
I stop
my
sleeping
Bible study.
around, maybe come to Jesus.
That?
We have those
Yeah,
moments.
yeah.
You may try to deal with yourself and your doctors or the universe in general in such way, like you're making deals with them, right? And then it's an attempt to also regain control over a life that suddenly feels unpredictable because you want to have some control and call some shots. And then depression enters. And this is where you see a lot of people bummed out and crying and isolating, where it's what's the point of all this? And at this point, some people really do end their lives. And some people stay home and waste away and start to disappear slowly.
Yeah.
The reality of your losses, the routines you've had to give up, the identity shifts, the isolation, it starts to weigh in heavily. And this is often the quietest stage where everything tends to slow down. And some people navigate it alone and some people reach out, right? And then we have acceptance, where some people now, when they get to that place, they're like, this is my reality now, and I can still have a meaningful life. Excuse me. And acceptance doesn't really mean liking your illness. No.
Yeah.
It means choosing to adapt, to care for yourself, to rebuild, to softly and truthfully start again on your own terms. And it's not linear. These stages are not linear. They can be chaotic all over the place. And that's the thing. With chronic illness, you move through them again and again. You get to acceptance, then you say, screw this. You're back to anger. And you're like, I'm going to look for Dr. Claire and tell her off, because why would she say that to me, that I'm not able to conceive?
Exactly.
And so on
Sometimes
and so forth.
it's even just the journey of the disease process itself.
Yes.
Like with flares, with endometriosis, just when you think you've navigated and gotten to a place where, okay, we finally found something that works. We finally found a treatment that's holding fort for a year. Then kidogo like this, you blink,
it's back.
We're back to even 10 times more severe symptoms.
Yeah, because I'm guessing you went through some form of treatment.
I had surgery in 2019.
Yes.
For endometriosis and fibroids. And for the first time since I was a teenager, I was pain-free. For the first time. I actually laugh about it because I had my first soiled episode, staining myself episode as a grown adult.
And it was a moment of joy for you.
Yeah, because I was like, oh, so you can actually have a period with no pain to the point where I'm actually staining? You know how crazy that is? Because for me, from day one, my very first period was agony. The pain started so many days before that even what I'd been prepared for, there'll be blood. My parents were really good at preparing me, and these are pads and how to use them. They didn't
follow that
pain.
template, did it?
They didn't factor pain at all. I mean, bless them, they wouldn't have known or thought to, because if you haven't experienced that kind of pain. But my experience had always been, I know my period is coming because I start aching 2-3 days before.
And it's debilitating, isn't
it? By the time day one comes, it's a write-off. So by the time I was having surgery, it was to the point where I was losing a day or two per month at work, which makes no sense because, again, your employer is like,
where are you, Dr. Claire?
Ni wewe peke yako. You know?
And are we paying you to sleep?
Exactly. So
for
then,
small cramps.
Yeah, so then post-op, a year was amazing. It was like, new lease of life. Who is this?
I know.
This? Let's go rediscover. We fit into
I have
everything
a similar
solidly.
story. Yes.
You look fantastic. You feel fantastic. And then literally a year in, the pain starts coming back.
And the disappointment of that.
Exactly.
And the rage sometimes.
Exactly.
And the disappointment or some form of depression. So I had a similar story. Since I was 18, my period was just a nightmare.
Yeah.
It wasn't heavy or anything, but in a month I had 3 to 5 decent days.
Right.
And that was my life until I was about 38. And at this point, before 2020, I had lost about more than 7 years where I couldn't even work. So I was just home, wasting away.
And everyone is looking at you like, what wasted potential?
I know.
We expected so much of you.
When will you get better? And I remember telling you how I saw 38 doctors. And the solution at this point was a hysterectomy. And then they said, go get a baby and then come back and we'll do it. Nobody asked me if I wanted to have a baby, right? But you know, again, the burden of the Black woman, go get a baby. And one told me, actually, I'll give you the surgery, but go tell a judge petition a judge to give me an order, and I'll give you the surgery.
What?
So then, by then, I was in severe depression. You kept making fun of my lack of curtains at home. Because I could have died of depression easily.
Yeah.
And when I had the surgery, which was because one of our best friends, James, bless his heart, he's the one who saw me disappearing and refused to let it happen.
Right, yeah.
And then, a number of friends helped me find a doctor. And I remember the first day I met her, Dr. Maria, and she looked at me and said, how have you been living?
Yeah, exactly.
And she told me, I can give you the surgery. When do you want to have it?
Yeah.
And I asked her, when does your calendar allow for it? She told me the amount of money, whatever, we looked for it.
Yeah.
And I had my surgery. And literally, from the day I got out of bed, I remember the day I woke up with no pain. I panicked because I thought something was wrong with me.
Truly.
I'd never known a life with no pain.
It's the exact opposite. You thought you'd feel relief, but now you're like, okay, but
my
everything I've
identity
learned,
has gone and
everything I've
shifted.
learned to be able to identify that there's an issue is gone.
It's gone, and now I'm not trusting my body.
Yeah.
And then going through recovery and having so much fun, coming back to life, beginning to work. And I remember being quite a bitch about it, asking guys, you guys just get up and get out of bed. Why are you not doing more with your lives?
Exactly, right?
And then many years in now, I'm needing another surgery because it's come back, it's spread.
Exactly. Yeah.
Even with the hysterectomy, it still came back.
Yeah.
And the rage that, you mean I could remove parts of myself?
Exactly.
And it's back.
And still suffer.
And learning to navigate that, even in therapy, has been quite a journey. Point being, none of this is linear.
Yeah.
The illness just shifts how you're experiencing it.
Exactly.
But again, you were asking what the cost of denial is when you don't process this. And the cost of denial is when you don't accept your condition, you could overwork yourself until you collapse because, I just need to keep moving.
You're
if I
preaching
stop,
to the workaholic in me.
Okay, I'll see you for
I'm
therapy
feeling
after
seen
this.
today. I need a session.
But you can overwork yourself to the point of collapse because you have been taught to believe that you're strong.
Yeah.
And a lot of people don't know when to trust their bodies and know that it's time to pause. You feel ashamed when you need rest because, and a lot of people say, when did I become this weak?
Yeah. Yeah.
And
who is
all
this?
I'm thinking
this is
this is not weakness.
Yeah, I know what
you
I'm
really
capable
are sick,
of. Yeah.
But you really are sick.
Yeah.
And some of this pain, a lot of people couldn't even go through a tenth of it and survive what you're surviving, right? And you also suppress emotions that desperately need space because you're not speaking up.
True.
The stigma of some of these illnesses is so high that people dare not speak up.
Right.
Just until the other day, we couldn't really talk about periods in public.
No, of course not.
Right?
Of course not.
And
Shameless.
everybody's talking about it.
Yeah.
You feel stuck in an old version of yourself because you're trying to get back there. You beat your body to lose weight when you know the hormones you have to take for treatment will
It's the
never allow
reason
you
why,
to do that.
yeah.
But you're still punishing your body and being brutal with it because you're stuck in a version of yourself that you used to know. You're like, I used to run marathons. What is this weakness?
Yeah.
I used to get to work at 6 a.m. I used to be the last person to leave the office. Acceptance is not giving up. It's choosing to live with your body and not against it, which is something in our society we're not taught to do. And the cost of denial is breakdown, even loss of your life if you're not careful.
Right.
Yes.
Tools to navigate everything we are discussing today, because I'm sure there's somebody at home who's doing, wait. They're speaking to me specifically.
There's an altar today.
Today is that day.
Yeah.
Are there ways that you would have, just expert opinion now, how can we navigate living with a chronic illness? How can we better navigate it? Because again, everything you've said has touched a nerve, and I'm sure it's not just me. I'm sure the audience as well.
Yeah.
Are there healthier ways we can approach the journey? Because it's not even a healing per se, because this is an ongoing. It's a journey.
Yes. Yeah. And for me, as a professional, and what I now call a professional patient, jokingly, I structure it in different categories. There's body, mind, heart, spirit, self, right? So what does it mean for body? even in therapy, we do have somatic experiencing where we help you to gently reconnect your body and mind. Like let them synchronize.
You said somatic experience.
Yes.
Okay.
And I'll walk you through it. So you know you're reconnecting body and mind by releasing trauma. That's stored in the nervous system. Even pain, releasing pain. You've probably seen people go through something called EMDR.
Yes.
Which we use for trauma.
Yes, yeah.
There's progressive muscle relaxation. There's trauma-informed yoga. But basically, it's just using your body to aid recovery, right? And there are other forms of alternative treatments outside of medicine, like almost, I don't know whether I should call them paramed or what, chiropractic care. You know, it will help realign your spine, your nervous system, and relieve pain. I see mine every Monday. After this, I'm going there.
So I agree, yeah.
So much screaming, but even in that screaming, there's release of pain, isn't it?
Yeah.
There's physiotherapy, you know, restoring strength, mobility, empowering trust for your body. Even your masseurs, they help you, if they're clinical, they help you learn how to trust your nervous system again.
Yeah.
And you learn to, you know, as a physio is teaching you how to learn to listen and pay attention to your limbs and trust them. The masseuse is actually helping you learn to trust your nervous system. These are things we really maybe don't pay attention to because we think it's for the soft brats sometimes, but it's not. It's really helpful. Pelvic floor therapy for women. A lot of people don't talk about this, but they're actual physiotherapists who that is their main focus. Yeah, especially helpful for reproductive, menstrual, and post-surgical trauma. Just learning to adapt to the body you're in and teaching it how to function again and to support the life you're creating.
Right. Yeah.
Right?
Yeah.
And then we go to the mind therapy. So, you know, trauma-informed and narrative therapy, where you learn to rewrite your story. You learn to trust yourself. You learn to believe your own pain. You learn to deal with all the things you've gone through as a result of being sick and dealing with people around you who haven't treated you very well when you were sick. And that's from doctors to family to friends to people around you who don't even know you. And we take a lot of people through cognitive behavioral therapy, where it's for thought loops, like shame, guilt. You know how you're triggered, it creates a thought. Then there's a feeling that comes with that thought. Then this is how you behave. And teaching you how to restructure your thoughts and shift your mind. And reframe things, say them differently, because vocabulary matters.
That's so true. That's
right?
so true, yeah.
And then psychoeducation. Knowing your condition gives you power. Even knowing how it affects you gives you power. You learn to advocate for yourself. It empowers you to even know when to stop, when to say no, when to proceed, when to just end it, end everything that you're going through and start in another new
a different journey
direction. Like you're like, I'm done being a doctor. Listen, I'll just sit at home and be a stay-at-home daughter.
Actually, there's that.
I can see that's why you wanted me to validate that.
Mom and Dad, can you see me?
But even mindfulness, grounding techniques, breath work, teaching you how to calm your body and racing thoughts, teaching you to live in today, because the danger is living far ahead on when you get better, when things calm down. And then heart, building a safe support system, learning to say no with peace, letting go of people who cannot hold you or hold you with softness. And then spirit, whatever rituals you have. Are you a faith person? Church, prayer, meditation, lighting candles if that's what helps you, taking sacred baths if that's what helps you release things, gardening if that's how you talk to your higher power. Go to the garden, go to Karura, do that. Sing, breathe, dance. You know, letting joy be sacred again, because one of the things illness does is take away your joy.
True.
You have to relearn joy and be stubborn with it, holding on to it, right? And then self. How do I rebuild my identity? And how do I romanticize my daily life? The small little things, your coffee, your tea, being able to walk barefoot.
My coffee ritual every morning is something I actually
Exactly.
cannot live without, because it changes my entire mental space.
But it's a ritual now,
it's a ritual,
isn't it?
Yeah.
So letting ease and beauty and play be part of your healing. And, you know, as we are teaching people to navigate this and to cope in a holistic way, one of the things you and I know as clinicians is that a lot of things have to be collaborative. For some people, their spirituality matters. We cannot negate or discount that when they come for treatment. We have to incorporate it. And if they tell you they're seeing their physio, you learn to work with their physio. You exchange notes, of course, with consent. Because that person, it's a whole person, and illness affects all of them.
It's truly how, like for me, when I practice, that's how I practice, multidisciplinary approach.
Exactly.
And then just for the doctors, any doctors or medical professionals watching, I encourage that we learn all the other alternative medical approaches as well as the paramedical fields, because you can work as a team. In fact, you should work as a team. Somebody who's navigating chronic illness and feels that physiotherapy is necessary, nutrition therapy is necessary, family therapy is necessary. Collaborate, create a team, because I create a team around my patients, because it's not just hormones and then go home. It doesn't work like that. So I think it's also important to just understand that the more you educate yourself as a medical professional, because we're not taught these things in school.
No.
We're not taught these things in school.
Our system has failed us.
Truly. And there's a bit of arrogance that comes from knowing I know everything to do with everything with the body. But that's not necessarily
true. But there's no
true.
better doctor than the person bearing that body, isn't it?
True.
And one of the ways in which, if you came to my office, there's so many things we'd have to talk about. And I can take you through that here right now. What is that look you just gave me?
I'm about to bypass that part so that we say maybe a part 2 of this episode, maybe.
No, but Claire, for example, now that you mentioned endometriosis, one of the questions I'd ask is, I'd like to know what parts of you have gone quiet since that illness arrived. So what dreams did you have to put on pause, not because you wanted to, but because you had to?
Right.
And what would you say to that?
Listen, have we turned this into a shrinking session for me? Yo, I'll start crying on set.
I'll sip my water as I wait.
Ooh wee. Hopes and dreams. I think it's the fear of not knowing if I'd have control over my body and for how long I'd have control. And I feel like mine became an opposite reaction, becoming hyper independent. I want to do everything now and make sure I do it by myself and prove to myself I can do everything. That was my response. Rather than sitting and feeling sad for myself, it was like a panic.
Like, and creating support for yourself.
Instead of creating support, I'm like,
letting people hold you.
No. And
I'm guilty of that.
That I'm learning now.
And I'm also guilty of that.
I'm like, no. Why
Super
are you
independent.
holding me? Why are you holding me? Get your hands. Keep your germs to yourself.
But people are trying to comfort you.
I know,
Because I think when people have known you a long time, they know that there are parts of you you're losing.
They can see the changes.
And they are going through their own form of ambiguous loss. Remember when we talked about that?
Yeah.
And what that means is that they're watching you die while still living. And they're trying to ensure that they can remind you of who you were.
Yeah.
Or at least see how they can support you now that you can no longer be that person.
Yeah.
And maybe another thing I'd ask you, I'd want to know how you've been taught to measure strength and how your strength is showing up differently now. So what if strength is not in how you fought, but in how you softened? Just from what you say.
Yeah.
What would you say to that?
Yeah. For me, I know initially my response was what I knew. I'm a type A. Literally that type.
What
that
is type
child,
A?
The
Everybody keeps telling me about that
overachieving
type
perfectionist.
A.
Type of child.
Yeah.
And then the reward for it in our culture, in society in general, is always extra. Because the more you perform, because we are very performative, even if you think of 844, the better you perform, the more you're rewarded. And so instead of seeing this as a coping mechanism, I'm seeing it as she's thriving.
Yes.
She's winning.
Yeah, but it's a trauma response, isn't it?
Exactly. Right. And then so now the way I have shifted is becoming soft, is letting people in, allowing people to support me, in fact, talking about the fact that I need support.
Which is a polar opposite of who you are, isn't it?
That has been a learning curve. That has been a learning curve.
Yeah.
So that then the people who know me realize, and I feel like I'm seeing it more and more, that when I reach out and I'm asking for help, it's because things are serious. Like she's not the type to ask. So when she asks, everybody shows up because they know for sure.
They also don't know you to just be an unnecessary imposition, isn't it?
Exactly.
And what does your body long to hear from you today? Like, where have you blamed her? And where can you now offer her perhaps an apology and some gratitude. You just really want to kick me, don't you?
I'm like, what? It's getting serious. It's getting serious. Although to be fair, I feel like I've been very kind to my body more than to my mind, because especially because of like the weight changes and the fact that nothing fits on one day, and then nothing fits as in I'm too big, and then Tuesday nothing fits because suddenly I've shrunk. And then I'm like, so what do you want in this wardrobe? Then you end up at work
I donated my clothes
in a mini dress because there's nothing else that fits, and now it looks inappropriate, and I'm like, but guys, this is all that fits.
I know. The other day I went with a kaftan to work, corporate place.
I know.
And I was like, guys, you shall not even ask questions.
Don't even ask questions. Like,
I'm here.
See, I'm here.
I have showed up.
Exactly.
I have
and
come
I'm
with
serving
joy.
You. As long as I'm here and I'm not in Woolworths looking for a new outfit, please leave me alone. But I feel like there I've given myself a lot of grace, because I've come full circle from change in treatment plan that caused extreme change in weight, and then I didn't recognize the body I was in anymore, and so navigating that, but being kind and telling myself, listen, you can't be in the gym as much as you want, you can't move your body the way you want to,
lifting 80 kgs. I've seen you on Instagram.
I'm back now. Oh.
Ungovernable.
So having to allow the grace, give myself, be kind to myself, and allow for this season that has now passed, thankfully, and now I'm back in the gym and I'm feeling, okay, at least I was kind, and now it's time to go be smooth. But then my trainer is like, can you chill? Because we're not going to find another flare in this gym. Chill.
Exactly. I'm with your trainer there. So you would say, I'm grateful to your body. What do you say I'm grateful for?
I'm grateful that you've shown up every day, despite everything. That's what I'd say to my body.
And what would you have wanted to hear at the point of diagnosis that you didn't hear? And what would you say to that body today?
That this is also going to be okay. Madam.
Sorry.
Hey.
Was not the plan. I feel like you started it and I'm ending it.
I'll have to call me Daisy to come back and do my face.
So can I ask you one last question? I promise it will be the last.
Okay.
What does healing look like now that you know it's not a destination, but a rhythm, a relationship, a becoming? Like, where am I already healing in ways nobody can say? It's not measured by a blood test or something tangible. What are some of the ways in which you've started becoming someone else and you're like, I'm getting to the other side, or I'm healing and learning things I wouldn't have known?
Right. Tolerance.
Okay.
I'm forgiving.
Endurance, you mean? Yeah.
No, tolerance.
Tolerance
I'm using the right
for
word.
people? Okay.
Yeah.
Oh, not for yourself. You're talking about others. Okay.
I'm talking others.
Tolerance.
Tolerance.
Okay. That's a big one.
I know. Because again, when you live in a body that's in pain all the time, and then someone you can see doesn't know what you're going through is making an issue of nothing as far as my brain is concerned, because your problems feel like they're magnified. There's the lashing out, there's the pushing away, there's the, again, hyper-independence kicking in. So I feel like I've come a long way from there, in that even when you're moving mad nowadays, I have a bit more tolerance. We're overcorrecting, but we'll come back. We'll find a healthy middle.
Sure.
But maybe that specifically for me. And I'm sure, again, I'd also like, as you put me on the spot here, I'm hoping the audience at home, as they listen or as they watch, are also answering these questions.
They're going to be answering, because I'm not even putting these questions to you as tasks to complete.
Yeah. It's something
I'm just
to
putting
ruminate.
a sacred invitation to begin again, to listen inward, to reclaim your body, not as a battlefield, because that's what chronic illness can make you treat your body as a battlefield, but like as a sacred ground, you know?
Yeah. Right. So I'm going to cut you short there.
Yes.
Because tears be damned. We're not doing that today.
Good to know where I can catch you, though.
I can see. Was this a safe space? I don't know.
It is very safe.
No, absolutely. It's only because it's you. You also know that. Because time is running out, and I don't want this to be too long an episode where we start to lose attention span, because we know how things are nowadays. Just as a final note, let's talk to the support system.
Yes.
Let's talk to those who know someone, either they live with them or they work with them, or somebody they care about and love, who they know is battling or struggling with a chronic illness. How can I be a better support system to the person
Right.
in my life who's suffering?
Right. So support doesn't always mean doing grand things. Yeah, because that's what a lot of people think it is.
Please, let's say that again, please, so
It
that
doesn't
for the
mean
ones
doing
at the
grand
back,
things, right?
it doesn't have to be grand gestures
No,
and
it's
suddenly taking over everything. No.
Exactly.
Yeah.
It looks like the smallest, kindest consistencies, right? And here's what makes a real difference. Believe somebody. Believe them. Don't make people work for believability.
Right.
Even when they smile, even if they say, I'm okay, learn to also ask, like, what kind of okay,
Yeah.
you know?
Yeah.
Because people with chronic illness will say they're okay a lot.
A lot.
Like,
It's just
the I'm
default
fines
setting. Yeah.
are so many.
How are you doing? I'm fine.
I'm fine.
I'm well.
But to us, it's
I'm
really
okay.
just a greeting these days.
Yeah.
And a lot of people will be like, no, how's your body doing? How's the body? And I've appreciated people who can say that.
Yeah.
And respect their pace. Don't push. Don't compare. Don't say, but I know someone else who had that illness. This is hogwash.
Yeah.
No, because that's the other danger. Let them set the rhythm. Move with their pace. Ask. Don't assume. What would support look like for you today? You're cooking for me all this food that I can't eat.
Exactly, yeah.
Might not be it.
Yeah.
Helping me go for a walk might be it. So asking how can I support you would go a long way. Include them, even if they cancel. I love my friends because they always ask me, even though they know I won't show up.
Yeah, exactly.
Ask.
Yeah.
Even if they come late
Yeah.
or leave early, the invitation matters.
Yeah.
Because the worst thing anyone can have is they're already isolating themselves and know they're dealing with exclusion. And that just makes you feel ostracized from society, right?
Yeah.
And then honor their joy. Chronic illness isn't all pain. There's humor. You and I have such dark humor.
So do I.
that has been honed by chronic illness, right? And pain. But honor their creativity, their insight, because now they see things differently. As a clinician, now you see so many things differently. And you're probably getting that kind of feedback.
Yeah.
I get that feedback all the time.
That's true.
And what I probably don't tell them is, I've been there.
Yeah. Yeah.
So let me just send you to the right doctors.
Right.
I just send them and then we talk about it later. Hold space for the full picture. So not also just their pain.
Yeah.
When you see their joy and other ways in which they're excelling, honor that. And sometimes just sitting with someone in quiet understanding is the greatest act of love, right?
Yeah.
Be the kind of support that doesn't make someone feel like they're a burden or make someone feel like they have to hide their illness from you. Yeah.
I love that. This has been a powerful episode. Thank you so much. I have a lot of things to go reflect on myself as well. But I'm just, as a final part for me, it's literally to say to anyone who's in the audience who's feeling like this was it's like they were talking to me specifically. This is us holding your hand. It's a journey. It's not a short journey, not necessarily the easiest one in the world, but you are capable. I guess that's the last message I would give, is you are very capable. And hopefully some of the tools that have been mentioned here will come into of benefit to you. And if you'd like to reach out, as always, I'll put all her details in the description box, in the caption, wherever you find us. And we can continue this conversation online.
Yes.
As opposed to continuing this episode. And for me, for the audience, those who've been able to watch or listen all the way to the end, I appreciate you and I look forward to seeing you on the next one.